One of the most important things you should know about your coverage is who to go to for care. In this lesson, we'll teach you how to make an informed choice for your care. If your school has a student health center, this is likely your first stop for routine medical and behavioral health care needs, such as allergies, rashes, acne, anxiety, and preventative medicine. If your school cannot treat you for these conditions, they will be able to refer you to another provider in the community. If your school does not have a student health center, consider visiting a telehealth provider or off-campus primary care clinic. If your school health plan provides access to NurseLine, this is a great way to get direction on what type of care you need. NurseLine can be accessed in your Wellfleet student mobile app. NurseLine is a telehealth service that lets you talk with a registered nurse who will guide you on how to address your medical concern, including recommending an appropriate setting to receive care. If you are experiencing a life-threatening emergency, such as severe bleeding, traumatic injury, severe pain, or trouble breathing, you should call 911 or visit an emergency room for immediate assistance. Plans like ours work with groups of doctors, hospitals, and other healthcare specialists throughout the country to ensure you can get the care you need at preferred rates. These are referred to as Preferred Provider Organizations, or PPOs. These PPOs are considered in-network providers. By going to an in-network provider, you are often able to receive care at a lower cost than if you go to a non-PPO or out-of-network provider. Out-of-network providers can still provide you with quality care, but you may end up paying more out-of-pocket for those services when compared to an in-network provider. That is because when you use an out-of-network provider, there is no agreed-upon payment amount for services. For example, if Dr. Smith, an out-of-network provider, billed $1,000 for an office visit, and the plan's allowed amount is only $500, Wellfleet would pay based on your benefits up to $500. Dr. Smith could then bill you the difference. For this reason, going to an out-of-network provider can result in higher costs for your care. If you're unsure what care you need and where you can find it, start by visiting your student health center or go to the Find Care tab on the Wellfleet student app. If you want to see a provider off campus, you can check your Wellfleet student mobile app to find an in-network provider. Remember, if you have a mental health emergency, call our Care Connect line 24/7 via the icon in your mobile app. Now that you know what to look for in a provider, continue to the next lesson to learn more about your care and coverages.